Hello everyone. Guys, we know that babies who are born to mothers who are living with HIV need to take their HIV medication from birth to prevent or to treat HIV. However, there hasn't been any guidance on how to safely use the 10 mg dolutegravir, which is a dispersible tablet for newborns in their first 4 weeks of life. In this video, I'm going to tell you about a research study which bridges this gap in neonatal HIV care. A research study which brings hope to newborns who are left behind in HIV treatment research advances. A study which is paving the way for an important HIV medicine to be made available to neonates in a safe and convenient way than previous options. So sit back and watch. This is the PETITE DTG study. The study was led by Professor Becker, who is a neonatologist and a principal investigator from Stellenbosch University. This research was conducted at FAMCRU, which is the Family Center for Research with Ubuntu, based at Tygerberg Hospital. The study aim was to test 2 pediatric formulations of dolutegravir. The study shows 2 new ways of giving the HIV medication dolutegravir to newborn babies who are less than 28 days. The first method involved using a 5 mg dispersible tablet, which dissolved in 5 milliliters of water and was given every second day for the first 14 days of life. Then once daily until the baby is 4 weeks old. The first method was administered using a syringe. The second method involved using a 5 mg mint-flavored film, the size of a fingernail, that dissolves on the tongue in seconds. The dosing schedule was the same as the first method. The findings were presented at the HIV leading conference called CROI, that is the Conference on Retroviruses and Opportunistic Infections, in March 2025. The findings showed that both formulations were safe and effective. According to Professor Becker, the study results showed that both 5 mg dolutegravir formulation was safe and effective and highly acceptable to mothers, with the dolutegravir film being particularly easy to administer. Close quote. Guys, it's important to note that at the end of the study, all infants were HIV negative. These results are a breakthrough and hopefully they will reduce adherence challenges among newborns. One of the main challenges with giving HIV medication to babies was that they didn't taste good and it was harder to give properly, especially if babies spit or vomited. Mothers wouldn't be sure whether the correct dosage was swallowed or not and whether to give another dosage or not. This new film method was very popular with mothers in the study because of its simplicity in administering the medication, the dose accuracy, and no risk of the medication being spit out or other spillage, since the film dissolves in few seconds after being placed in the baby's tongue. According to Professor Becker, this film method is one of the least disruptive ways to give medication. It is the most unintrusive way of administering medication, since the babies are completely unaware of what is happening when the mother put the film in their mouth. Close quote. These research findings were presented to the World Health Organizations and they are expected to be included in their upcoming updated dosing guidelines for infants and children. This film method isn't yet available commercially. Hopefully, once it has been included in the WHO guidelines, it will be made available soon. What do you think about this important advancement in neonatal HIV care, guys? What difference do you think it will make in the lives of the newborns? Please leave your comments below. Please don't forget to subscribe. I love you guys. Please continue to stay safe and stay safe. Goodbye. Nisale kakuhle, lisale hantle, .sins, lisale khabu.